I'm Dr. Andrew Johnson, and the most important thing that I've realized in the last so many years of making digital dentures is that the value of the technology doesn't just exist at the end of the line. Yes, we can make computer-generated dental prosthetics that are stronger and more hygienic and infinitely more reproducible than anything we could do with traditional means, but in my opinion, the power of the technology exists all the way across the clinical process, up to and including the very first patient interaction. For instance, when patients come into my clinic with old dentures, no matter how poorly fitting or unesthetic they may be, I've delegated the digitization of those dentures as a starting point to my assistants. We're using our chairside intraoral scanner device to scan the tissue surfaces, the tooth surfaces, and the bite relationship, and then we just database that information. We also database pictures of them smiling in those dentures using simplistic means of photography like iPhones and iPads is perfectly sufficient. So that when the patient elects to actually pursue real replacement denture treatment, we're not starting at square one. We're literally starting at the finish line. Because in the background, using the 3D teeth and the 2D faces all superimposed in computer software, we can create customized 3D printed wax try-ins that are pre-corrected from an aesthetic standpoint and ultimately modifiable and natural in appearance. These are not monolithic, monochromatic, monoblock digital denture try-ins. These afford the clinician the ability to flex and move and make corrective actions right there immediately chairside, and they allow the patient to see something that looks human in the smile. So that in the course of one consolidated clinical records appointments, we can take this starting point, which is basically 90% of the way done, and create perfectly border molded master impressions, get perfect centric relation bite registrations, and show the patients in the mirror what we actually can deliver on in terms of the aesthetics and the functionality of their smiles. So when this information comes out of the patient's mouth, it is redigitized chairside, submitted electronically for final denture production. There are no questions remaining unanswered. Therefore, the final denture product that is output at the end of the line is perfect. It is a promise that we can keep, and it is something that benefits our patients and our practices alike. Because something this efficient, something this effective is only so when you can leverage the technology from the end all the way back to the beginning. And that's my best advice.